Most people are terrified of having a heart attack or stroke. But what if I told you the first signs of danger might already be inside your arteries, quietly building up without a single symptom? The scary part is that you wouldn't feel it. No chest pain, no shortness of breath, just a gradual, silent narrowing of the blood vessels that supply your brain and heart. And here's the twist. It's not just what you eat that makes a difference. What you drink every day could either help unclog those arteries or block them faster. As a doctor with over 15 years of clinical experience, I know how important evidence-based advice is. That's why I've included references for every drink in the description below, so you can look them up and explore the science for yourself. So let's get straight to it, starting with one of the most powerful drinks backed by real science, pomegranate juice. This vibrant, ruby-red juice is more than just a trendy superfood. It's one of the most studied drinks when it comes to artery health. A landmark clinical study in patients with significant narrowing of their carotid arteries, the ones supplying the brain, showed that drinking just 50 milliliters of pomegranate juice daily for 1 year reduced plaque thickness by up to 30%. That's remarkable. It also improved blood flow and reduced systolic blood pressure by about 12%. The secret? Powerful antioxidants called punicalagins. These compounds reduce oxidative stress, decrease inflammation, and improve nitric oxide production, which helps blood vessels relax. The key is choosing 100% pure juice, with no added sugars or concentrate. If the flavor is too sharp, mix it with a bit of water or green tea for a more palatable, equally effective option. Now, let's talk about green tea. You've probably heard it's good for you, but you may not know just how powerful it is for your vascular system. Green tea is rich in a compound called EGCG, or epigallocatechin gallate. This antioxidant has been shown in multiple human studies to improve endothelial function. That's the ability of your blood vessels to expand and contract appropriately. One study showed that green tea improved flow-mediated dilation, a gold standard marker of artery health. It also helps reduce LDL cholesterol and gently lowers blood pressure. Drinking 2 to 3 cups of green tea daily has been linked with a reduced risk of cardiovascular disease. Choose high-quality loose-leaf or bagged green tea, and avoid sugary bottled versions that are often stripped of their benefits. You can enjoy it hot or cold with a squeeze of lemon to boost antioxidant absorption. Next up, beetroot juice. This deep purple drink is a natural powerhouse when it comes to cardiovascular support. Beetroot is packed with dietary nitrates, compounds that your body converts into nitric oxide, a molecule that helps widen blood vessels, improve blood flow, and reduce blood pressure. In clinical studies, just 140 milliliters of beetroot juice significantly lowered systolic blood pressure, sometimes within an hour. One trial even showed improvements in endothelial function and arterial stiffness in older adults after just 2 weeks of daily beetroot juice consumption. It's particularly helpful for people with borderline hypertension or signs of poor circulation, like cold hands or feet. Start with a small glass on an empty stomach and be aware that it may color your urine or stools, a harmless and temporary effect. Our next drink is hibiscus tea. This beautiful red herbal tea has been used for centuries in traditional medicine, but modern science confirms its impressive cardiovascular benefits. Hibiscus is rich in anthocyanins and flavonoids that help lower inflammation, improve lipid profiles, and relax arterial walls. In one randomized controlled trial, participants who drank 3 cups of hibiscus tea daily for 6 weeks saw their systolic blood pressure drop by an average of 7 millimeters of mercury, a result comparable to some antihypertensive medications. It's caffeine-free and can be enjoyed hot or iced, making it a great option for evenings or during warmer months. Just be cautious of pre-sweetened blends or bottled versions. They often contain added sugar that can negate the benefits. Let's move on to drink number 5, cranberry juice, but not the sweet syrupy kind. Unsweetened cranberry juice is loaded with flavonoids and polyphenols that support endothelial function and reduce markers of inflammation like C-reactive protein. In one study, Regular cranberry juice consumption led to modest reductions in systolic blood pressure and improved antioxidant status. These compounds also help prevent LDL cholesterol from oxidizing, which is a key trigger for plaque formation in the arteries. If the taste is too tart, dilute it with water or use it as a base in smoothies. Combined with fiber-rich ingredients like oats or berries, it becomes a potent drink for cardiovascular support. You've made it halfway. Just a quick request to say that if you have enjoyed this video so far, please do consider subscribing. Now for something you can make at home: garlic, lemon, and honey tonic. It may sound simple, but the ingredients pack a serious punch. Garlic contains allicin, a natural compound with vasodilatory, anti-inflammatory, and cholesterol-lowering effects. Lemon provides vitamin C and bioflavonoids that reduce oxidative stress. Honey, when used in moderation, can soothe inflammation and support immune health. One trial found that people who drank a garlic and lemon mixture daily for 8 weeks had significant improvements in cholesterol levels and blood pressure. To make it, crush 1 clove of raw garlic, squeeze in half a lemon, and stir in a teaspoon of raw honey with warm water. Drink it in the morning on an empty stomach. The taste is strong, but the results are worth it. Drink number 7 is a golden turmeric latte, also known as golden milk. This warm, comforting beverage contains curcumin, the active ingredient in turmeric. Curcumin is one of the most studied natural compounds for inflammation. It inhibits multiple pathways that contribute to arterial plaque buildup and has been shown to reduce LDL cholesterol and triglycerides in people with metabolic syndrome. In older adults, curcumin supplementation improved arterial elasticity and reduced markers of oxidative stress. To prepare, warm a cup of unsweetened plant-based milk, add half a teaspoon of turmeric, a pinch of black pepper to enhance absorption, and a touch of honey or cinnamon if desired. Drink it in the evening to help your body recover and repair overnight. Now let's talk about an oat and berry smoothie. This drink combines 2 of the most artery-friendly food groups, soluble fiber and polyphenols. Oats contain beta-glucan, a type of soluble fiber that binds to cholesterol in the digestive tract and helps remove it from the body. Berries, especially blueberries, raspberries, and strawberries, are loaded with anthocyanins that reduce inflammation and support endothelial health. When blended together, this creates a drink that not only lowers LDL, but also improves insulin sensitivity and gut health. Try blending half a cup of rolled oats, a cup of frozen berries, a tablespoon of flax or chia seeds, and unsweetened almond or oat milk. This is a breakfast you can drink, and your arteries will love you for it. Drink number 9 is chia seed water with lemon. Chia seeds are a nutritional powerhouse. They're rich in alpha-linolenic acid, an omega-3 fatty acid that supports heart health. They also contain soluble and insoluble fiber, magnesium, potassium, and plant-based antioxidants. When soaked in water, chia seeds form a gel that slows digestion, balances blood sugar, and promotes satiety. Several human studies have shown that chia seed consumption can reduce blood pressure and improve cholesterol levels, including a reduction in LDL and an increase in HDL. To prepare, add a tablespoon of chia seeds to a large glass of water, let it sit for 15 to 30 minutes or overnight, and squeeze in fresh lemon juice before drinking. It's simple, hydrating, and surprisingly filling. Finally, drink number 10, diluted apple cider vinegar. Yes, this one's a bit controversial, but emerging research suggests it may have modest cardiovascular benefits when used properly. A meta-analysis of small human trials found that apple cider vinegar can lower total cholesterol, triglycerides, and fasting blood glucose. These changes can indirectly support arterial health by reducing damage to the endothelium caused by high sugar and lipid levels. Just 1 tablespoon of ACV in a large glass of water before meals can make a difference, but be sure to rinse your mouth afterwards to protect your tooth enamel and never drink it undiluted. Now that we've covered what to drink, let's quickly touch on what to avoid. Sugary sodas, sweetened iced teas, bottled smoothies, and energy drinks are some of the worst offenders when it comes to arterial health. They spike blood sugar, promote insulin resistance, and trigger inflammation, all of which contribute to plaque buildup. Even drinks marketed as natural or organic can be loaded with hidden sugars. Always read labels and prioritize drinks with simple, whole ingredients. Your arteries don't care about marketing, they respond to biochemistry. So, how can you put this all into practice? Start with a daily routine. In the morning, try chia lemon water or a garlic lemon tonic. Midday, sip on beetroot juice or green tea. With meals, rotate between pomegranate, cranberry, or oat berry smoothies. In the evening, relax with hibiscus tea or golden milk. You don't need to use all 10 at once. Start with 2 or 3 and build from there. The goal is consistency, not perfection. Most people wait until a scan shows a blockage or a sudden emergency forces them to take their heart seriously. But you don't have to wait. You can act now, before the damage becomes permanent. Your arteries may be quiet, but they're always responding to what you put in your body. These drinks are tools. Use them. If you learned something new today, please give this video a like so others can discover it too. Comment below which of these drinks you already use or which one you'll try next. And if you'd like more science-backed health tips that actually make a difference, subscribe and join me for the next video. Because prevention doesn't start with pills, it starts with what's in your glass.